Good afternoon, everyone. The practical topic for today is necrosis. Definition: necrosis is defined as a localized area of death of tissue followed by degradation of tissue by hydrolytic enzymes liberated from dead cells. It is invariably accompanied by inflammatory reaction. Causes: necrosis can be caused by various agents such as hypoxia, chemical and physical agents, microbial agents, immunological injury, etc. There are two essential changes that characterize irreversible cell injury in necrosis of all types. First is cell digestion by lytic enzymes, second, denaturation of proteins. This is the figure in which we can see a normal cell either goes necrosis or apoptosis. In cell necrosis, there is homogeneous eosinophilic cytoplasm and the nuclear changes are pycnosis, karyolysis and karyohexis. Whereas in apoptosis, there will be condensation of the nuclear chromatin and fragmentation of the cell into cell-bound apoptotic bodies which are engulfed by the macrophages. As it is seen here, apoptotic bodies engulfed by the macrophages. Coming to types of necrosis. Morphologically, they are classified into 5 types: coagulative, liquefactive, caseous, fat necrosis and fibrinoid necrosis. Coagulative necrosis. This is the most common type of necrosis caused by irreversible focal injury, mostly from sudden cessation of blood supply, that is ischemia, and less often from bacterial or chemical agents. The organs commonly affected are heart, kidney and spleen. Gross. Foci of coagulative necrosis in the early stage are pale, firm and slightly swollen. With progression, they become more yellowish, softer and shrunken. Microscopy. The hallmark of coagulative necrosis is conversion of normal cells into the tombstones, that is, the outlines of the cells are retained so that the cell type can slightly be recognized, but their cytoplasmic and nuclear details are lost. The necrosed cells are swollen and appear more eosinophilic than the normal cells. This is the photomicrograph in which, this is the image in which we can see there is viable renal cells tissue. These are inflammatory cells and here is the necrotic tissue. Same can be seen here. This is the viable renal tissue and this is the necrotic tissue. The affected area is showing intensely eosinophilic cytoplasm of the tubular cells, but the outlines of the tubules are still maintained. The nuclei show granular debris. The interface between the viable and the non-viable are shown by non-specific chronic inflammatory and proliferatory vessels. This is the the demarcation between the viable cells and the non-viable cells. Next, liquefactive necrosis. Liquefactive necrosis is also known as qualiquative necrosis, which commonly is due to ischemic injury and bacterial or fungal injury. It occurs due to degradation of tissue by the action of powerful hydrolytic enzymes. The common examples are infarction of brain and abscess cavity. Grossly, the affected area is soft with liquefied center containing necrotic debris. Later, a cyst wall will be formed around this debris. Microscopy. The cystic space contains necrotic cell debris and macrophages filled with phagocytosed material. The cyst wall is formed by proliferating capillaries, inflammatory cells and gliosis, that is proliferating glial cells in the case of brain and proliferating fibroblast in case of the abscess cavity. This is the photomicrograph showing liquefactive necrosis of the brain. Here again we can see this is gliosis, granulation tissues are seen and this is liquefactive necrosis. Same here, liquefactive necrosis is seen with gliosis and few granulation tissue. Third is caseous necrosis. Caseous necrosis is found in the center of foci of tuberculous infections. It combines features of both coagulative and liquefactive necrosis. On gross, There are foci of caseous necrosis resembling a dry cheese and are soft, granular, and yellowish. This appearance is partly attributed to the histologic effects of the lipopolysaccharides present in the capsule of the tubercle bacilli, that is Mycobacterium tuberculosis. On microscopic examination, the necrosed foci are structureless, eosinophilic, and contain granular debris. The surrounding tissue shows characteristic granulomatous inflammatory reaction consisting of epithelioid cells with interpressed giant cells of Langerhans type or foreign body type and peripheral mantle of lymphocytes. These are the photomicrograph. Here we can see Langerhans type of giant cells. Here you can see Langerhans type of giant cell. This is caseous necrosis. Same here, caseous necrosis. And these are the giant cells which are seen. Fat necrosis. Fat necrosis is a special form of cell death occurring at two anatomically different locations but morphologically similar lesions. These are following acute pancreatic necrosis and traumatic fat necrosis commonly seen in breast. On gross, the fat necrosis appears as yellowish white and firm deposits. Formation of calcium soaps imparts the necrosed foci firmer and a chalky white appearance. On microscopic examination, the necrosed fat cells have cloudy appearance and are surrounded by an inflammatory reaction. Formation of calcium soaps is identified in the tissue sections as amorphous, granular, and basophilic material. This is the photomicrograph from acute pancreatitis, which is showing fatty necrosis. There is cloudy appearance of the adipocytes. And there is coarse basophilic granular debris while the periphery shows mixed inflammatory infiltrate. Last type is fibrinoid necrosis. Fibrinoid necrosis is characterized by deposition of fibrin-like material which has the staining properties of fibrin. It is encountered in various examples of immunologic tissue injury, for example, immune complex vasculitis, autoimmune diseases, arthrus reaction, and in arterioles in hypertension and peptic ulcer. Microscopy. Fibrinoid necrosis is identified by brightly eosinophilic hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by nuclear debris of neutrophils, and local hemorrhage may occur due to rupture of the blood vessels. This is the photomicrograph which is showing fibrinoid necrosis. Here we can see polymorphous neutrophils and some nuclear debris. The vessel wall shows brightly pink amorphous material and nuclear fragments of the necrosed neutrophils. In this photomicrograph, we are seeing this fibrinoid necrosis in autoimmune vasculitis. Thank you.